So we'd like to welcome all of our parents to the reopening webinar. This is going to be talking today about career entitled education and inclusive education. Steve, you want to go ahead and do the slides? So these are our panelists today: Mr. Alan Bike, our district superintendent; myself, Tom McNair, director of instructional programs; Mr. Matt Sheehan, principal for the Center for Career and Technical Excellence; and we're hoping to have Marissa Knapp from the Broome County Health Department join us here in just a few minutes. So this is what we're going to talk about today. We're going to talk about the reopening plan, the instructional day. Mr. Sheehan is going to talk a little bit about that. We're going to cover student health, building hygiene, PPE, which is personal protective equipment, and building access. And then we will discuss social distancing. So the webinar format today is this format. It's a Zoom call. We ask that you please participate. Put your questions in the question and answer section, and we will be sure to get to all of your questions by the end of the presentation. We will actually answer the questions at the end of the presentation. We do have a couple of people who are answering questions right along if they're relatively simple questions, and that is Steve Moshak and Jeff Franey, our assistant principals. You will notice that the chat feature is not working on this, has been disabled for this session. So now I will turn it over to Mr. Sheehan to talk about our reopening plan. Mr. Sheehan.
Thank you, Mr. McNair. So when we start talking about our different plans or how we want to go about opening our schools, I'm going to try to do it as simple as I can for our half-day programs.
Sounds like your volume's not working, Matt.
I hear him.
Although it looks like you're not on mute.
I hear him. I hear him fine.
You can hear me fine, Mr. Bike?
Yes, I do.
Okay. I'm going to keep going. I'm wondering if Mr. McNair needs to take me his computer volume.
Okay, you're all set. You're good.
All right. So starting from the beginning, we're going to go back to, for our 9 through 12 programs, Broome-Tioga BOCES has gone to a plan. So like most of the districts, we were trying to figure out how we can not have too many kids to make it unsafe, but have as many kids as possible here to make sure they get their education. So we're doing where every one of the schools would follow their school district's plan. So if you're in a district that does a Monday, Tuesday with one group of kids and then a Thursday, Friday with another group, they would come to CTE, P-Tech, EverTech, and on those days. If you're with if you're at a district where it's going every other day, they would come to CTE every other day. Our teachers will be teaching remotely during that time. Well, not remotely. They'll be Zooming in their class at the same time so that your son or daughter would actually show up to that class. The teacher will have the lesson right there and have work for them to do from home on the days they're not here. In terms of inclusive ed, so that's East Learning Center for Alternative Ed, West Learning Center for Alternative Ed, and the EverTech program. They're going to use the same schedule for all of the students in the high school alternative ed program. So that means that they will also be put into a cohort by your school district. They'll be coming to school on certain days of the week based on their cohort. And then on the other days, they will attend virtually. There will be assignments. Everyone will be using Google Classroom in the 9 through 12 at Broome-Tioga BOCES. They will be using Zoom for arriving to the actual class when you're not there. So the students will use that to submit their work and be involved, and they'll be expected to be involved in the conversation that's going on in the class so that they know what they need to learn and they're learning what they need to do. And then when they're here, they're going to do a lot more of their hands-on that they traditionally do. A lot of our work is a little balance of both traditionally. So we're just going to try to get as much of it as possible when we're not here to be the non-hands-on, and all the hands-on to occur when the kids are actually in the building. So the other thing that we're really concerned about is making sure our students' health is nice and safe. And so we made adjustments to our health office that are a couple major things. We've created isolation rooms that are off of our health office for students who are showing symptoms. If we need to isolate them, which is in accordance with the CDC guidance on that. We plan on having parent communication with you regularly. And what we're talking about there is looking at our screening questions that you'll be able to see online or you'll be able to see when you're a district. We're going to make sure that you're following those and you let us know and that your kids are not coming to school when they have symptoms. One of the biggest things we want to do is think about this as risk reduction, is to not have lots of students with symptoms in the building, but kids who are feeling healthy and are healthy coming around. Every day we'll be doing a student screener. So either the students coming off of their bus or will be screened by their district. And if they're coming by themselves, so if they're driving, drop off, walkers, okay, maybe they wanted to walk up the hill that day, They will come through a separate entrance and they will have to fill out a paper screener every day with one of our staff members, and then they'll come in the building. We also will be doing periodic temperature checks with those kids coming in through the student arrival entrance or the non-bus entrance. The bus entrance, we're assuming with working with our districts, they've assured us that all of those students will have already been screened before they ever got on the bus to come to us.
So Marissa Knapp is our partner that we've been working with through the Broome County Health Department. She has not been able to log in as of yet, I don't believe. We just double, oh, there she is. Marissa, are you there? Are you there, Marissa?
She was having some difficulty and I know Michelle is helping her connect.
Okay, so what we'll do is we'll just continue to the next slide and we'll come back to Marissa when the time is right. So you can see here, ventilation system. We've done a lot of things looking at all of our ventilation systems across our buildings, making sure that the airflow is as good as possible. We're using only New York State approved disinfectants in our cleaning procedures. We're working very closely with our operations and maintenance staff, making sure that they're cleaning all high touch surfaces and areas. Really classrooms, student entryways, cafeterias, hallways, all of those things those high touch surface areas are getting cleaned regularly. Our staff is also cleaning outdoors as needed. And then our cleaning staff is keeping the log of every single thing that is cleaned, what time it's cleaned, et cetera. So they're making sure that everybody knows what was cleaned and when it was cleaned. Our second and third shift are also doing a real deep dive clean. So that's happening on a daily basis.
Tom, I think we do have Marissa on now. Let's just confirm that she's actually able to hear us. Marissa, can you hear us?
Hi, yes, can you guys hear me?
Yes, you're there.
Okay, I apologize. We have to call in with our phones because our computers don't have cameras or a speaker. So this technology is tough for some of us, and I'm one of them. So thank you so much for having me. So my name is Marissa Knapp. I'm a public health educator for the Broome County Health Department, and I have been assigned to be your school liaison. What that means is I am here for any questions that parents, staff members, teachers, anyone has to help you through all of the public health aspects of COVID-19 and with school opening. So COVID-19 may be a new disease, but contact tracing and case investigation is a practice of public health for decades. It is something that we've done for years with several communicable diseases. So we have a lot of knowledge and history with doing case investigations. So I just want to explain what a case investigation looks like. So if you are a student, a teacher, a community member, the case investigation looks the same for everybody in the community. So let's give an example of, we have a teacher at BOCES who tests positive. We will receive their positive test result in a computer system, and we are reaching out to them typically within 24 hours. We all are working 7 days a week. So if something happens in the evening, if something happens over the weekend, that's not just going to sit there. So we don't want people to worry about that. We're working 7 days a week, and we work late into the evening and early in the morning. So when a case investigation is done, we really go through a timeline of where that person has been in the community, specifically in this case in the school, and who was a close contact. So what we consider a close contact is anyone who is 6 feet or closer for 10 minutes or more with or without a mask. Now that obviously goes out the window if 2 people are hugging or kissing or have a much closer contact. So that's just an example of where, we would definitely determine that person as a close contact. So the person who tests positive, that means they were swabbed, they have that positive test result, they're called in isolation. So isolation and quarantine are 2 terms that we use. They in essence mean the same thing, that you're separating yourself away from other people. But isolation is the term that we use for someone who tested positive, and quarantine is for someone that is a close contact. So I'm going to give an example. Let's say Mr. Sheehan tested positive for COVID-19. That means Mr. Sheehan would be home, he would be isolating, we would be having these conversations with him. And let's say Mr. McNair was at work and he was a close contact to him. We would then put Mr. McNair in quarantine, and everyone in Mr. McNair's family wouldn't matter. They wouldn't be in quarantine. They're called what we would say a contact of a contact. So Mr. McNair's family would be okay. He just would need to be quarantined in his home. And then Mr. Sheehan, everyone in his family would also be in quarantine because they had that contact with him. So a lot of times we get the question, you know, what if you are a teacher in the room next door and, you know, maybe you were close contact to the person that tested positive? What does that mean for the students in your class? Those students are okay. So for someone that's in quarantine and isolation, we have a conversation with them every single day. So the health department does the case investigation, we issue the isolation or the quarantine, and we're checking in on that person every day, making sure they don't have symptoms, making sure symptoms are improving, making sure that they're staying quarantined or isolated. So it's not like we issue this, we tell them they have 2 weeks, and then we don't talk to them again. So we're there also to support if someone else in the family has symptoms, you know, we're there that whole time to help them through that. We have several testing sites available in our county right now. We always encourage everyone to work with their healthcare provider. So whether it's your child's pediatrician, a primary care provider, if you don't have those options, both Lourdes, UHS, and Unwell Family has virtual walk-ins available that are available 7 days a week into the evening also. And for testing, that's where you would first reach out to your healthcare provider about testing. Additionally, we have the Binghamton University test site. There's a few pharmacies that are doing testing. So we will make sure the schools have all of that information about testing that's available. I do quick want to talk about, because, you know, Broome-Tioga BOCES. So if you live in Broome County Health Department will be the one who oversees your case. If you're someone that lives in Tioga County, the Tioga County Health Department will reach out to you. Now, let's say you have a teacher who might live in another county. We work with that county to get all of those names. So I can assure you that anyone who needs to be contacted and placed in a quarantine, we promise you we're working with the other county health departments, with the other state health departments. We assure that those people will be contacted. And like I said, we're available 7 days a week. The most important thing we just want to stress is right now, more than ever, it's important that we are monitoring our children and how they are feeling. You as parents definitely know your children the best. So if your child, you know, is sleeping more than usual, if they're telling you they have a headache, if you decided to get them tested and have a result pending, we just really encourage you to keep your child home, because this is often what will happen. Someone has mild symptoms, they then decide to get tested, and the results, depending on where you're tested, can take up to a week. And those are the 7 days in there where someone could have the virus and be spreading it, you know, at school, you know, within groups of friends. So we just really encourage everyone, if you are not feeling well, if your child's not feeling well, to stay home, especially if you have a result pending. Additionally, we know that the virus is primarily spread through particles. It's the fastest way of transmission. It's not a very hardy virus, so it doesn't really live on surfaces for very long. And that's why masks are so important. In public health, we strongly believe in masks. Masks help slow the spread. So we really encourage masks to be worn. And additionally, I know that mask breaks are being discussed and talked about. This is where we look to the state to help us provide guidance on how we can do these things. With that said, things have changed so much with COVID-19 in the past few months. This is a new virus. We are all learning together. And, you know, what I tell you today might change a little, you know, by the time school starts. So we just ask that you be patient with us. So I just want to share my contact information. If anyone has a question that you're not able to ask today, I'm here to help you with that. I'm here to support you. I will do anything I can. You know, it's definitely scary if you have someone that you care about, a child, a family member who, you know, was diagnosed with COVID-19, or also someone who was placed in a quarantine. So I'm just going to give my contact information. So my number at work is 607-778-2812. And then I'm going to give you my cell phone number. I am able to text message, so if you have a question and want to send it by text, I'm happy to get that to you. My number is 607-288-3278. And one last thing I want to talk about is confidentiality. We at the health department are bound by HIPAA. So if you have a child that tests positive, we are not going to put a Facebook post out there or post it on the school's website, because we have to follow HIPAA. So I know that at times our community can seem very small, and you know, a lot of people know each other. We as the Broome County Health Department would never disclose your child's information, their health information. With that said, if there is a positive case in a class, we have to contact Trace, and we have to reach out to the school so we get, you know, the proper phone numbers, parents' names. If someone is under the age of 18, we legally need to reach out to the parent. So we would be reaching out to the school when we do the case investigation and identify, you know, what class, what part of the building that child was in, and then whose name we need. So I just want to explain that. We always follow HIPAA, but to make sure we properly protect everybody, and so that person isn't a threat to spreading the virus, we do need to reach out to the school for that contact info. Okay, so what type of questions can I help answer?
Actually, Marissa, we'll go ahead and take questions at the end. That was very well done.
Okay.
Much appreciated. You can see all the information that Marissa just provided, and we'll come back to that, and we'll answer any questions that anybody has. But we're very fortunate to have Marissa and the Department of Health working so closely with us. We as schools certainly could not do it alone. We need to leave some of that stuff to the experts. And, you know, we're doing what we can in our buildings to make sure everything is safe, but we need our Department of Health and those folks as well. So thank you, Marissa. And I guess I'll turn it back over to Mr. Sheehan for this slide here.
So we're a massive school with a lot of different things going on. So we made one of our committees came with a list of essential visitors. So the only people who will be coming in the building without an appointment this coming year will be our agency service providers. So like an outside agency that works with students and coming in, emergency responders and first responders, food delivery, maintenance and repair services, substitute teachers, school district personnel, and mail delivery. So school district personnel being like someone from a school district coming to see a student or coming for a meeting. So most of these people though won't come through the same entrances at all, and none of them will be coming through the same entrances as your son or daughter. Your children will be coming through two entrances. So we have one for buses, we'll have one for drivers and riders, and those are the only two entrances the students will be using in the building. They'll be using an array of exits that are from their classrooms to make it so we don't have as many kids walking with one another or so close to one another, as Marissa's talking about contact tracing there. We are going to require face coverings for students. If you're looking for what is an actual face covering in the eyes of Broome-Tioga BOCES, we have a reopening page right on our website. There's a huge red tab you can click on. It's in our guidance. There's a lot of options, but we're looking for something that cloth covering that covers their nose to their mouth so that they can't transfer any of the, I guess, germs would be the word. So the face coverings will be required in a lot of different areas, but not at all times. So whenever you're within 6 feet of someone, in our hallways, in our bathrooms, in our common areas, other very like lots of places where we have lots of students, in our cafeterias, they'll wear them until they sit down. A lot like what you look like in a restaurant, but if they're sitting at their desk in a classroom and they're 6 feet away from everyone else, they can take their masks off to be able to work and do things in that nature. The other thing is parent access. In the past, parent access has been, you can come to the building and come right in. We're not going to be doing that this year. We will be doing appointment only. So if you want to come in to meet with one of our staff members or us, it would be an appointment. And then if you're picking up your son or daughter, in the past, you had to come in the building. This year, you will set up the appointment, you'll call the phone number, and then we will walk your son or daughter out and have you sign out from your car. Again, just trying to cut down on the number of people coming in the building. We also, you'll be getting a letter in the mail or mailing them out, I believe, tomorrow. It has your student schedule that kind of laid out. And when I say schedule, what the overall program schedule is, not what they do first period, second period. It also has a map of our building from a bird's eye view of where our entrances will be, which affects when you guys are coming, so you know, and you can look at it ahead of time. It has the detail of what a face covering is, so it was really easy for people to think about what they need to get. So that will help you guys a little. That will be coming out in the next day or two, and you should be seeing it in the mail within the next week. But that will really break down what you're looking for in parent access and face coverings and essential issues.
So our last slide here, we're going to have signage all over the building, strategically placed, on our campus, entrances, hallways, cafeterias. Matt mentioned the social distancing piece of it when he talked about face coverings and people entering the buildings and that kind of thing. So safety is extremely important. Nothing is more important than your student safety. Training for all staff, and students, we're making sure that everybody is trained in hand washing, face coverings, social distancing, all of those types of things. And those things will be reinforced throughout the school year, as well as specifically trained on right at the beginning of school. And so they'll be getting that from the BOCES, as well as most likely their home district. And then we've changed schedules around as needed, just to maintain social distancing, to make sure that we can keep kids and staff as far apart as possible so that it is safe. In some cases, schedules may be in the library, they may be in a cafeteria, etc., just because we have to use every inch of space that we have to do what's right for our student population and our staff as well. So that's what that's really about, all that social distancing piece. So now we're really at you can go to the next slide, but we're at the questions section. We kind of went through some of that quick. I know some people jumped on a little bit later. So any questions that you have, please put them in the question and answer. And at this point, Mr. Bike, did you want to say something at this moment?
No, let's do some of the questions and then I'll just make a couple of comments near the end, but let's see what questions we've gotten so far.
Okay, so I'll turn it over to Mr. Moshak. What questions do we have?
All right, so question number one, there's 3 people have asked in regards to their student is doing the fully virtual option. Will they have a fully virtual CTE option as well? I think this goes probably to Matt.
So our teachers are planning to have a fully remote option for your son or daughter to do their work and do what they can. And we will be able to support them as long as your district is supporting that decision. We'll be able to support that. Our teachers will be remote every day at the time that their class starts, because they're going to have students who are already remote who are in the hybrid model. So the difference would be they would be doing remote the entire time.
All right, be ready for the next question. What is going to be done for students who have medical issues which preclude wearing a mask?
Well, I'll take that one. We're going to be looking at each student on an individual basis. We have to make sure that we're doing what's right for each and every one of our students, and those situations vary from student to student. New York State Education Department gives us very clear guidelines on what we can and cannot do, and so we will be following that. And if there's a medical issue, a mental health issue, or the like, then we will take a look at it, work with the parents, work with our administration, work with our teachers to make sure that we're doing what's right for our students.
Can I just add into that one, Tom, and say that
Yeah.
If you have a situation like that, please let us know that in some formal way as soon as you can, because one of the things that we'll want to make sure that we do for the safety of our staff is if they need to provide services to students who will not have masks on, we want to make sure that we're giving them the extra protective equipment if necessary. So to the extent that we can plan that ahead of time, that would be very helpful and appreciated.
Steve, can I answer a question that I answered, but I didn't fully answer before?
Yes, sir.
All right, so Nuvision, there was a question about the Nuvision schedule. The way the Nuvision schedule will work is the students will attend the 3 days that they are not in English or social studies, because they have a schedule based on a Monday through Friday to begin with. They will attend their classes those 3 days. And then for their English and their social studies class, they will be split alphabetically to make it so there's half the kids in the class, because those rooms traditionally have 25 students at a time in them. So to make it so it's a little safer for everyone, we're going to have them on week 1, half of them will go to English, The other half would go to the social studies in person, and they'd flop the week before, but they'd still attend virtually when they're not in school. I hope that answers the person who asked the question about Nuvisions. Turn it back to Mr. Moshak.
All right, we have a question in regards to breakfast and lunch. How will you keep students socially distanced?
So I will handle that question. So we have rearranged our whole cafeteria. Those of you who've never been here, we have a lot of round tables that are really good for socializing with people and making friends and working on those skills. We do not have that this coming year. We have very long 8-foot tables that we'll be using, and we'll have kids sitting in the same direction while they're eating their lunch, and they'll be able to sit at least 6 feet apart, if not a little more.
That's good. We have a question related to a parent who has a student in Oak Tree. If my child is in Oak Tree and will attend school 4 days a week, 1 day in the class and the other days in the Oak Tree classroom, will they be able to attend their CTE class 4 days?
I'm up again. So they will be able to attend any day. So the way the cohorting works for us is any day that you are attending school at your home district in any capacity, you will come to CTE on those same days.
Steve, could I go back just to the lunch question? And I'm asking Mr. Sheehan, and this will prove to the parents that we didn't pre-rehearse this, because I'm asking you a question on the spot. Do we have programs within our BOCES there some of the students may actually be eating in their classrooms and not going to the cafeteria, and that will help cut down the population in the cafeteria?
Yes, Mr. Bike. So actually our EverTech program, which is the only one that we oversee that involves this one, is going to eat in the cafeteria every day. But some of our PALS and Oak Tree programs where they have less need to go to the cafeteria and they can actually eat in their rooms and they have enough space, they'll be eating on what they want to do is an alternating schedule. So they eat breakfast one day in the cafeteria, that day they'll eat lunch in their classroom, and the next day the opposite. So those kids still get their ability to socialize and work on those skills, but at the same time maintaining a safe distance for everyone.
Thank you.
All right, we have a question in regards to who do we contact if we decide to go fully remote? Also, when does that decision need to be made?
So you would work with your school district on who you contact about being fully remote, and then they would let us know that you plan to be fully remote, and we'd mark that in our attendance, and then we'd get in contact with you probably via phone call the first time to make sure your son or daughter knows how to log into their Zoom and their Google Classroom to know how to get into their classes so they can actually have their programming provided to them.
We've got 2 questions left, so keep the questions coming if you at home have any. We have one related to a Vestal student. So my child goes to Vestal and they are only going in person 1 day a week. He's in your culinary program. Does this mean he goes to you 1 day a week and then the rest of the week from home? Should I expect him to do cooking projects at home, which is fine, but just looking to have a little idea of what to expect?
So Vestal is actually sending students to us on Wednesday and 1 day a week on top of that for their CTE programs. So they'll come here 2 days. But to answer your other question, there could be times where they ask you to work on your knife skills of cutting an onion at home or something that is a standard thing that's usually found. They might even give the onions out the day before. Our teachers are gonna have to be very creative in getting some hands-on skills for kids who are at home, because traditionally a day in a CTE class usually goes with about 20 to 30 minutes of lesson or lecture and then an hour of hands-on work. So any way we cut this, that's still gonna be what they do, but they're not gonna always get that hands-on work. So we're gonna have to be creative. I do not think they'll be cooking in a professional grade where they're gonna be doing like a roast beef dinner, but I could see them asking them to do, hey, we got all these carrots, take them home. We're gonna have you tomorrow on the Zoom, practice cutting them, julienne, and cutting other styles. I only know one cutting style. Maybe I should take the culinary class. I'd know a little more, but same concept. We did this summer, the Cosmos students took the mannequin heads home, and they actually took me a minute there, I forgot the word, and they were practicing their different skills on that so the teachers could see it. So it would be a similar setup of that nature. Things that could be done from home, we might ask them to, but I don't think we're gonna ask kids to be welding at home because not everyone has those materials available. So they'll be doing some of their work for their certifications and their core for certification.
Steve, can I just ask a quick question? I know that we had on our website a location for parents to put questions in ahead of this webinar. And I just want to make sure that we don't miss any of those questions that they may have asked previously.
All right, we're on that. We have a question in regards to Binghamton. Will students from Binghamton be in school every day?
So right now, Binghamton made a decision to change their schedule. And we are working closely with them right now. It all happened pretty quickly. But our stance, and Mr. Bike, certainly correct me if you think different, is that we will be accepting Binghamton students to some degree, even before they start on November 5th, December 5th.
October 5th.
Excuse me, October 5th. I'll get the month right yet.
So Binghamton, I've confirmed with the superintendent that even though they plan on going remote until October 5th, that any students that are enrolled in BOCES programs, including CTE, will be transported to BOCES as appropriate based on their schedule, so that the Binghamton students would not miss out on that opportunity in the month of September.
All right, we have a couple questions in regards to transportation that people filled out ahead of time, and one currently. We should expect, this is a question, should we expect to receive a schedule and bus information?
So I can answer that. Traditionally, we don't do anything with the transportation. That is the home districts to make those decisions. They should expect to receive that from their district. And every district's going to do that in a different time, in a different manner. But they would handle that part. We don't handle the transportation part. And then from us, we're sending a letter out this week, and hopefully we'll get to you guys by next week with a lot of different information to hopefully you can save on the kitchen refrigerator for an idea of what we got and what we're trying to figure out. And it's going to be one of those things that we're, as kind of like Marissa said, we're going to be learning with you. So we're going to have some things we might change right away, or as we learn, this is a better way to do it.
Matt, I have a follow-up to that as well. We had some people respond to this in our online survey, and a question recently. We've had parents ask, student is attending 2 days a week, supposed to, what if they drive? Can they attend more than the 2 days a week?
So at the current moment, they cannot attend more than the 2 days a week. So we're using the district's hybrid schedules to make sure that our student numbers fit the classroom space. If all of our students were here under certain guidelines, not all of our classes could be open. But once we get going and we know more about that, we will be able to adjust. But for now, we're using the district cohort schedules, and that's what we're going to use for when kids are supposed to be here.
And so all of that is also on our website for every single program that we offer in the Center for Career and Technical Excellence and Inclusive Ed, actually across Broome-Tioga BOCES. You will see a page for your program that your son or daughter participates in, and it will outline all of those things as far as when your student is supposed to come to school. And certainly if you have questions, call us. We're here to help.
I would also add, just on our PT BOCES website, on the main homepage of the tabs of information, there's now a red tab there that has more information about our reopening plans, and will point you to additional information.
Now we're jumping to some questions in regards to our online learning. Some worries that having a student in the 12th grade who's in their second year, how are they going to be able to make sure that they ensure that they are meeting the same material as if they were live? So let's take, they have the electrical program here.
All right. So when we think about how they would do this, we're looking at how we're teaching and what we teach. So in the second year program, they still have to go through a lot of different things that are not just hands-on. They have to make sure they can do their code book. They have to do their electrical math, all these little things that you don't need to be in person to do. We're going to plan to do remotely as much as possible. And so they can get as much time in their, they're called electrical bays. So I'll say in their bays to get the work and the hands-on experience. And the goal is to increase that as much as possible and then go from there. But it is still not the perfect scenario for education in a career and tech ed world. If we were able to bring students back 100% and not have to worry about safety, we would want to. I mean, I would want to, I'll say that much. But at the current moment, we don't have the spacing or the systems in place for that to happen.
Question, Matt, in regards to the wait list. If this is a student who goes to UE, if they want to know where they're at the wait list, who should they talk to?
They should work with their home school district counselor. Their counselor gets an email every week from our office telling them where the wait list is at and what students are on it and where. Steve, there's somewhere in there's a welding question that I wanted to answer. I can't remember the exact questions. If you could find it at some point and ask it, that would be very beneficial.
There may have been a typed answer to that. I can't remember. It was a Vestal parent regarding welding.
Okay. Well, we're looking at that, looking that up right now. One more, Matt, while we look for that. My son is in hybrid at UE 2 days out of the week. If he switched to full-time at home, how many days will he attend BOCES?
I'm going to ask Mr. McNair to answer that question.
So I believe the question was if UE hybrid 2 days a week, and then the parent decided to keep their child home 5 days a week. Is that correct? Is that what you said, Steve?
Yes. Yep. they
So
switched.
the way we are running that right now is if your son or daughter is in school at UE, they come to Broome-Tioga BOCES. If they don't go to school at UE, then they don't come to Broome-Tioga BOCES. That's kind of how we laid it out for social distancing purposes. Like Matt said earlier, if we accept it, if we didn't have a hybrid model, there would be no way to get our welding students, our heavy equipment students, et cetera, all into those spaces safely. And we can't put anybody at danger. So, but we are working with, if something came up like that, the way we want to handle it is we want to work with each school district and each student on an individual basis to make sure we're making the right decision for that child. Now, we do have some parameters we have to live under, unfortunately, but we're here to help you. So if you do have a question and it's not getting answered, or maybe from your home school district because they don't know the answer, connect with us and we'll help.
I found the welding question, Steve, if that's, and it might have been answered, but it says Vestal, this is a Vestal student. He needs welding to complete his education. Can he choose to go 5 days a week if desired? He has no need to go to Vestal and did not last year. Has transportation. Is attending all days possible to get the most hands-on possible is the question.
So the answer to that question is we are still, the days he would attend Vestal, even if he's not, they will assign him to a cohort. He will attend those days in person. The rest will be done virtually online. That will be synchronous at times and asynchronous at times also.
So as of now, we've answered the questions. People out there, feel free to keep asking them, type those questions in especially if we haven't answered it fully like you've been looking for. Probably wait up.
There was a question just answered. I was going to answer in this right now, so I'll answer it before you guys answer it typed. But the question was, will the learning be synchronous or asynchronous? And it will be a combination of the two. The way we envision it, there will probably be some work where they're in a lesson and the teacher is teaching, and then the teacher is going to tell them in your Google Classroom, there's this assignment, please have this done in the next hour. And then they'll probably hop back into a Zoom at the end of class to do a check-in and maybe do a check for understanding and talk about what they did in their assignment. So they'll be doing a combination of the two. Your school districts are planning to follow a schedule for remote. It's the same way. So your kids will not have a competing classes at the same time. If they're with us in the morning, they do with us in the morning in a virtual setting. Same thing in the afternoon.
And I will just say, our teachers really have gone above and beyond. I mean, it's just such a difficult situation for a teacher to be asked to teach kids in person and also through a hybrid and remote model. And they really have stepped up. So we feel pretty comfortable, as comfortable as we can in this nature of things. Our teachers really have stepped up, and we feel confident in the education that your kids will be getting.
Man, can I just, oh, sorry.
No, go ahead, Steve. Go ahead. I just have
Well,
comments when ready.
This is it's been answered, but you probably want to reiterate this. I'm looking at the online survey question. If welding was not held in person, is there a way for students to use the equipment and work on projects, either scheduling on-site time or using equipment at home? I know this will be important for a lot of the CT classes, just to stress what we're doing.
So Steve, I want to make sure I understand the question. So I'm paraphrasing. They're asking if they can schedule time to come in to use the equipment outside of the school day?
Yes.
At the current moment, we don't have a schedule for that or a plan to do that. That does not mean we won't. I think what will happen is we've said a lot all along the way. We don't know what we don't know yet. And I think we might find out that's something we need to offer 1 day a week where kids can come back and do it if it's what's going to make the difference for them being able to make those welds or make the cut or or know how to actually lay out a stringer for a wall, all those different pieces. So we would utilize that if we need to. It's just going to require us to be able to understand that. At the current moment, we are not planning that. I did see the next question is about what's a typical day, and it said Vestal, but I'll say for all programs. Typical day for all programs is to end here by 2:10 and to start here at 8:35. Now the AM session is 8:35 to 10:55. The PM session is 11:40 to 2:10. So those are the times, but those are the typical times they'd be expected to be in class.
Okay, we have one more that popped up. Should we expect direction from school districts or from BOCES as to where my child needs to go and what time? And I think this is a fully online student. When will they be attending and how? So who will communicate that?
So our game plan for that is, so we have not received information from the districts yet letting us know that anyone is fully on time, fully virtual. Once we get that information, our expectation is the week of after Labor Day, so I think it's September 8th, that week our teachers are here. I will expect that every one of my teachers that has a fully online student to call them and explain their schedule and also work through the phone with them to make sure they get logged into their Google Classroom, because the number one place for the information will be there. We're still exploring the idea of doing a virtual parent night and same concept. So you could set up meetings, come in, talk about your student, and make sure that you have the right information for the Google Classroom. So we want to make sure that everyone is communicating as much as possible. But if once we hear from a district that a student is chosen by, so let's just use UE sends us their list and says, following 15 kids are going fully virtual, I will then look at what classes they're in, share it with the teachers and our guidance counselors, and we'll make contact with them about that.
One of the keys is communication, as Matt kind of alluded to there. We know the importance of communication with parents and school districts, and so that's of utmost importance to us. And we're gonna do everything we can to make sure you have all the information we have, and that we're answering your questions not just now, but really all the way through the school year, making sure that everybody feels comfortable.
All right, so we do have a question that popped up saying that they had to tell their student back on the 12th, or tell the district back on the 12th that they had chosen virtual. Just wondering why have we not heard from that yet? Matt, you could probably answer that because of how big the nature is of it.
I think that I would just say, I think the nature of our programs and our pieces that are here, our school district's guidance counselors are traditionally who we communicate most with, district to district. And our counselors are not working full time yet in any districts. They work one day here, one day there, and same with our two. Ours come in next week for a full week, and during that, we'll get all those lists as detailed as possible.
If I make a couple comments, just quick comments.
Sounds good.
I don't know who's going to tell you no.
Hey, first of all, I wanted to thank all the parents who participated. One of the things that you probably are hearing is that, we're dealing with 15 school districts who have a variety of ways that they're addressing the reopening of school. What we're trying to do is to be the most accommodating resource, not only for the schools, but for your children as well, because we don't want to see kids lose opportunities. Many of our programs are better suited for in-person. I think educationally, any educator would say this is, it's much better to have students in school if we can. And we're going to do the best that we can to provide the safest environment. The one thing I continue to ask the parents, just as we ask our staff every day, is please, everybody, do your part to help with that. Where you have seen in the media where school openings have had some difficulties, or where universities opening have had some difficulties, some of that is because of the behavior of the students. And we're going to do everything from our end, and we really appreciate your patience as we try to put all this together. Nothing is perfect, and things could change every day, and we're going to try to do our damnedest to keep you up to date as we do. I think Marissa would agree on the phone from the health department that the guidance they receive from New York State changes on a daily basis, and we just want to make sure that we're doing the best we can. And I want to thank the staff, but I also want to thank the parents for taking the time to participate with us. Marissa, anything you want to add at the end here?
No, I just, I echo everything that you guys said. I think it's difficult to being administration and educators all the time, but right now, the one thing that we all have in common is that this is new for all of us, and whatever decision you as a parent make you know, for your child and for your family is the right decision. If you have any questions that you didn't want to ask on the call, I'm definitely here to help. I've had a lot of people reach out that, you know, sometimes just need to hear from a health perspective, you know, because it is confusing and what sometimes you see in the media isn't always the case. But yes, our guidance here comes from the New York State Department of Health and then also the CDC. So we are here as a resource, so please reach out if I can be of any help.
So Tom, we do post this video, or will post this video on our website once it's
Yeah.
downloaded? Okay.
Yeah, so this has all been recorded, so we will have this posted to our website. Again, this is just the first of many communications that we'll be having with our families. So if you have questions, we're here to help. And I'd like to say thanks to all of our panelists today for coming in. And again, thanks to our parents for joining us, and we will talk to you soon.
Good
Have a
night,
great
everybody.
night.